Thank you so much. Good evening once more. My name is SINKAMBA TODDY. I'm going to present to you a study based on knowledge and practice of breast self-examination amongst the female student nurses at St. Luke's Cove Nursing in Rufunza. Rufunza is in Zambia. The introduction basically is that cancer is one of the leading causes of death among middle-aged women, and it is becoming a major public health problem in developing countries, and this includes Zambia. At the age of 16, my own daughter was found with a lump in the breast, and I therefore got interested to take up this project of establishing the knowledge and practice of self-breast examination among young girls, and in particular, I decided to look at the female student nurses. My objective of the study, which was the general objective, was basically to compare the knowledge and practice of breast self-examination among student nurses and distinguish variations or associations among the study variables. And for me to achieve that main objective, I had to break down the specific objectives, and the first one was to assess the knowledge of breast cancer and breast self-examination among student nurses, to compare the knowledge of breast cancer and breast self-examination among students in year 2 and those that are in year 3. Also to assess the practice of student nurses towards breast self-examination. At the same time, to make recommendations to the General Nursing Council of Zambia. The variables that were under the study were basically two: knowledge and practice. The methodology that I used, of course, it was, like I've already alluded to, was conducted at St. Luke's Cove Nursing, which is in Rufunza, Mpansha, and the study design was exploratory and comparative in nature. Permission to conduct the study was obtained from the Research Ethics Committee of the institution and the General Nursing Council of Zambia authorities, and also the informed consent was gotten from individual students who participated in the study. The study units were female student nurses that were aged between 16 and 49 years, who were in year 2 and year 3. A total of 50 female student nurses participated in the study, and the study adopted a systematic random sampling technique where I used a sampling frame of intakes, which had a total of 175 student population. The data the data collecting instrument was a 28-item semi-structured interview schedule, which I developed, and also the face-to-face interviews were conducted. At the same time, the respondents were interviewed independently. The instrument was pre-tested in order to assess validity, at the same time precision, and after data was collected, raw data was edited for completeness and consistency, categorized, at the same time coded. I used the Info statistical package to analyze the data. At the same time, the spreadsheet analysis, I used it so that I determined the associations between the variables. The results, when you look at the results and in terms of knowledge, you could see that the one that is about 80 are students that were in year 2, in year 3, sorry. And then the blue one was for those that sorry for that. The graph represents the knowledge differences that existed between those that were in year 2, I beg your pardon, because it showed that they had no knowledge about 80%, and then those that were in year 3 had knowledge about 20%. The other significant issue that we looked at was basically when it came to practice. In both intakes, I realized that both did not actually practice the breast self-examination, and you could see the levels were basically almost similar regardless of the knowledge that was there. And the reasons for not practicing breast self-examination, some of them included lack of knowledge. When you look at year 3 and year 2, basically they were almost at the same level. And others thought that it was not necessary. They did not think that it was important, and therefore you could see there was 4% and 7%. And then others just said, I forgot for the reasons that basically is known to themselves. But then, when it came to the discussions of findings, the results basically showed significant differences in breast cancer knowledge, as alluded to earlier, because the p-value basically was 0.000. And the knowledge levels were higher in year 3 compared to the counterpart in year 2. The differences in knowledge levels could be due to easy access to information and level of training by those that are in year 3 than those of their colleagues. Many students, both in year 2 and year 3, did not practice breast self-examination. This also could be attributed to lack of specific information about breast self-examination as a screening tool, which, according to Steinbeck in 1994 as well as Gore in 2000, they postulated that knowledge of breast cancer and provision of screening guidelines is related to high screening rates. And the major reasons that were cited by students for not practicing self-breast examination, like I have already alluded to, was basically lack of knowledge and skill on how to perform the breast self-examination. They did not think it was important to examine themselves. At the same time, they did not even perceive themselves to be at risk. Better in 1995 also found that many women in America, they also gave similar reasons for not practicing self-breast examination. It was also the same that was seen when Mukupo also looked into 2006, looked at the urban and rural population. She basically found out that the reasons were similar. The conclusion of the findings, they showed that a large percentage of year 2 students had no knowledge about breast cancer than those that are in year 3. There was also a significant difference in knowledge levels on breast cancer was observed between the two intakes. Students in year 3 had more knowledge on breast cancer than their counterparts in year 2. Breast self-examination practice was poor in both intakes. They mutually did not practice breast self-examination. I therefore made the following recommendations to the nursing council that the content that is in the nursing curriculum be looked at so that it incorporates the tutors and the peer educators as master trainers on the dangers of breast cancer and breast self-examination techniques, so that they equip students, nurses, that will in turn educate the communities on the dangers of breast cancer and how to conduct breast self-examination. I also made the recommendation that government should develop a policy on breast screening. Breast self-examination should be recommended as the best screening tool, as recommended also by WHO, especially for our country, Zambia. Also, education programs on breast cancer and breast self-examination should be conducted on electronic and print media by the Ministry of Health, because they are the custodians, and also other concerned stakeholders, so that teaching manuals and teaching aids are used by health care providers in a more uniform manner. I also made the recommendation that the Ministry of Health should incorporate, rather, Ministry of Education should incorporate the in the school curriculum for secondary schools as well, which probably was missed out, and at the same time to look at a more rigorous study to be conducted so that we shed more light on the subject matter. Those were my references.